Hantavirus outbreak. We're keeping a close eye now on where those exposed passengers are in the U.S. At this time, 18 passengers from the ship have been taken here to the United States. 2 in Atlanta hospitals for treatment tonight. 16 of them arriving in Nebraska this morning, with 1 of them testing positive for the virus. Good evening, everyone, and thank you for joining us. I'm Mackenzie Johnson. Rod has the night off. Uncertainty is growing as the public is anxious to hear about the quarantine plan and where we go from here. Health officials and state leaders are answering some of those questions today in Omaha. Channel 8's Danielle De Silva joins us live now from UNMC after learning some of those details for us. What do we know tonight, Danielle?
Mackenzie, a team of highly trained medical professionals are keeping a close watch on the 16 patients that arrived here at the National Quarantine Unit. And Governor Jim Pillen says that the state of Nebraska is equipped to handle these types of situations.
I begin by expressing my incredible appreciation for the countless professionals, both federal, state, and local, who have burnt the midnight oil and worked extensively in the last days to have a safe transfer.
Governor Pillen assuring the people of Nebraska on Monday that those passengers who have been exposed to hantavirus are getting world-class care. 15 passengers are staying in individual rooms in the quarantine unit. The only passenger who tested positive is in the biocontainment unit in another facility, which is more like a hospital setting. No word tonight on when that patient can leave the biocontainment room, but health officials say none of the 16 people are showing symptoms as of Monday morning. The passengers range in age from late 20s up to the 70s and 80s, and they will need to be monitored for symptoms for the next 42 days during the incubation period, which is recommended by the CDC and state health officials. Experts are now questioning each of the patients, hoping to figure out the exact moment they have first come into contact with the virus. But this morning, they remain adamant that the general public is not at risk. Rooms are secured with heavy filtration systems described as negative pressure spaces that helps to keep both the patients and staff safe. The CDC says this is not a mandatory quarantine, and health officials tell us one person is requesting to leave Omaha and go home to monitor their own symptoms. Despite no symptoms in any of these patients at this time, they are still within the 42-day incubation period and are being closely monitored. If any of them begin to show symptoms, then doctors here say that they have contingency plans ready for each patient that's been individualized for them. As we learn more, we'll be keeping you updated. Reporting live from Omaha, Danielle De Silva, Channel 8 News.